Hi, today I'm going to walk through how to prevent medication errors and how to prepare and give an intramuscular injection. So you want to check the medication with the Medication Administration Record, or MAR, 3 times: at removal of the med, at preparation of the med, and at administration of the med at bedside. When preparing a medication, remember the 6 rights: right patient, right medication, right dose, right route, right time, and right documentation. Intramuscular injection sites include the deltoid, vastus lateralis, dorsogluteal, and ventrogluteal. And intramuscular needles are 1 to 1.5 or 2 inches long, and they can be 19, 20, 21, or 22 gauge. Intramuscular needles are inserted at a 90-degree angle, and IM syringes depend on the amount of medication that's being administered. It can be 1 milliliter, 3 milliliters, or 5 milliliters. It just depends on how much you'll be giving. If you have a doctor's order and know that the allergies your patient has will not interact with your medication in a serious way, wash your hands and gather your supplies. For an IM injection, you'll need gloves, at least 2 alcohol wipes, the medication, the proper needle gauge and length, and your patient. Also check for the expiration dates of the medication. Withdraw the correct amount of medication before going into your patient's room. In this demonstration, there's an order to administer 0.5 milliliters of sodium chloride intramuscularly into the deltoid. First, you'll clean the top of the vial with an alcohol wipe. You'll inject air into the vial that is equal to the medication you're about to remove. Withdraw the correct medication amount. Remove air from the syringe. Recap the needle. You're taking it to the patient's room, so it's clean. You want to protect yourself from stabbing yourself and infecting the patient. And then you would change the needle if necessary. Since the syringe I'm using doesn't have the correct needle on it, I switched it for a proper IM needle. Take your prepared medication and supplies to the patient's room once you have everything prepared, and then you'll introduce yourself to the patient, explain the procedure, wash your hands, and put on your gloves. You also double check if your patient has any allergies again, and see if your patient's lab values and vitals are in a good range for the medication to be given. You are ready to give an IM injection. We're using the deltoid in this demonstration. So you'll clean the skin with an alcohol pad. You'll stretch the skin taut. You'd use a dart-like motion to insert the needle at a 90-degree angle, then release the skin, slowly inject the medication, remove the needle, and then dispose your needle in the sharps container. You don't want to massage the area, and then you'd clean up, so wash your hands, all of your supplies, ensure your patient is comfortable, not presenting any abnormal signs and symptoms, and then document. And that's how you give an intramuscular injection. Thanks for watching.